All right, and in just a minute, I will click start webinar and everyone can start logging on. All right, I'm going to go ahead and start the webinar. Hi, everyone, and thank you so much for joining us today. We're just going to give everyone a few minutes to log on, and we'll start shortly. Hi, everyone. Thanks so much for being here with us today. I'm just going to give everyone a few minutes to log on, and then we'll get started. Hi, everyone. Thanks so much for being here with us today. I'm just giving everyone a few minutes to log on, and we will get started soon. Hi, everyone. Thanks so much for joining the call. We're just going to wait a few minutes for everyone to log on, and we'll get started. All right, and with that, we're going to go ahead and get started. So hi, everyone, and welcome back to another MassMEDIC webinar. My name is Anna King, and my pronouns are she, her, hers, and I'm a marketing coordinator for MassMEDIC. I'm so excited to be here with all of you for such an important conversation. And for those of you joining us who may be visually impaired, I can be described as a white woman wearing a blue sweater. And just a few housekeeping notes before we get started. This webinar is being recorded and will be available on our MassMEDIC YouTube channel after the event. We'll also have time for a Q&A at the end, so make sure to drop any questions that you may have in the Q&A function down at the bottom of the screen. So I'd like to take a minute to welcome everyone to our event and say thanks to MedTech Color for their partnership, and a big thanks to all of our speakers for being here today. Shout out to some of our MassMEDIC members on the panel. We've got McDermott, Will and Emery, Veranex, and Active Surgical. And if you're not familiar with MassMEDIC, we're a membership-based trade association for the medical device industry. And we work to bolster our ecosystem in New England through connection, education, events like this, advocacy, and awareness. And most of all, our team is dedicated to the long-term success of the medtech industry. I mean, this industry is essential and it's exciting and it's growing, but we're also facing challenges, right? We're in the middle of a workforce shortage. Across the board, we see our member companies that are struggling to fill medtech jobs, especially ones in manufacturing that don't necessarily require a 4-year degree, but can pay really well and provide a path to growth and provide a purpose. And in addition, you know, it's clear that there are racial disparities within our industry. So to bring more innovation and to bring new life-saving technologies forward, we need to make sure that MedTech is a place for everyone and encourage them to join. Everyone in this industry has a why, a reason that they do what they do. For me, I'm actually a heart transplant recipient. So getting to work in the same industry that helped save my life has been so rewarding. And that's why MedTech is all about, right? Inspiring others by sharing stories. So in collaboration with the state of Massachusetts, last July, we launched Why MedTech. It's a multimedia branding campaign to increase awareness in the industry. And since then, we've been collecting and sharing the whys from a bunch of MedTech leaders. And our mission is to inspire those outside of MedTech to realize the fulfilling and life-changing opportunities that this industry, especially in places like Massachusetts, has to offer. And creating awareness with why MedTech is just one piece of the puzzle. So we continue to build collaborations across the state and throughout the industry that will support technical training and educational pathways, paying particular attention to some of the most underserved areas in our region. So it's a great time to get involved and watch stories and share stories and even tell your own. And I think that this is where I plug our social media accounts. So please give us a follow on Twitter and Instagram at WhyMedTech. You can also visit our website, whymedtech.com. And we also really do want to hear from you. Your story matters. Why did you get into this industry? Why do you do the work that you do? So you can check out our website to submit a story or contact us to set up a time to talk more about how we can work together to share your story or those within your organization. So turning back to the content of today's webinar, you're just about to hear some wonderful Why MedTech stories live. Actually, Manisha on our panel today, the CEO of Active Surgical, has an incredible Why MedTech story that we shared a few months ago. I know she'll be speaking on her experiences here today, but if you get the chance, definitely check that out. And honestly, I'm just thrilled to be here for this discussion with such awesome female leaders in MedTech. And not only will you hear their stories, but we'll start the discussion about how we can work to ensure that MedTech is a place for everyone. So thanks to everyone who supported our campaign so far. We hope that you enjoyed today's webinar, and we're looking forward to hearing your why. So with that, I'll pass it over to Ariana from MedTech Color. Thanks so much.
Thank you so much, Anna, and thank you everyone for being present at this impactful conversation today. My name is Ariana Martin del Campo. My pronouns are she, her, hers, and for those who are visually impaired, I can be described as a Hispanic female wearing a pink blazer. And I'm the program coordinator for MedTech Color, a nonprofit organization whose mission is to advance the representation of persons of color in the medical device industry. And we are proud to partner with MassMEDIC today in honor of Women's History Month to bring you the stories of a few incredible, diverse female leaders in our organization and in our industry. And with that, it is my pleasure to introduce you to the moderator of today's discussion, Vanessa Pollard, a founding and board member of MedTech Color and the Food and Drug Law Practice Leader and co-chair of the Global Life Sciences Practice at McDermott, Will & Emery. Thank you so much, Vanessa, for being here today.
Thank you, Ari, and thank you, Anna, and many thanks to MassMEDIC and to MedTech Color for putting this incredible discussion and panel together. I'm particularly honored to be here among this group of women. And one of the things that makes the MedTech industry so special is that we do leverage very diverse perspectives and experiences to really try to impact patient health in positive ways and impact the public health in incredible ways. And this group of women are among the shining examples in our industry of leaders who are making an impact. So my pronouns, for those of you who are listening and visually impaired, are she, her, and hers. And I am a Black woman. I am wearing a red blazer, and I have locks. So to get started, I would love to turn it over to each of our panelists to introduce themselves briefly, and then we'll get into our Why MedTech discussion. So Kimberly, would you like to kick it off, please?
I would love to. Thank you, Vanessa. Welcome everyone to the discussion. I am incredibly honored as well to be on this panel with women who I have had a chance to interact with, and I'm excited to get to know some as well. So Kimberly Sterling, I am the VP of Global Value and Access at ResMed, a San Diego-based MedTech and digital health company. I am actually based in Indianapolis. I always say that San Diego based, but I'm in Indianapolis in the Midwest. And my pronouns, she, her, hers. And if you're visually impaired, I am an African-American woman. I also identify as Afro-Latina. And I have on also a reddish orangish shirt.
Great, thanks, Kimberly. Deshawn?
Thank you, Vanessa, and thank you everyone for attending this webinar. And I too am also very honored to be part of this distinguished panel. My name is Deshawn Dorsey, and I'm the Executive Director of AdvaMed ASCEL, which is the small member company division within AdvaMed, the Advanced Medical Technology Association. And I also lead AdvaMed's Health Equity Workstream, a task that I took on the tail end of 2020. My pronouns are she, her, and hers. And if I were to describe myself for those who may be visually impaired, I am an African-American woman with a bun, currently wearing a tan sweater and a blouse covered in oriental poppies, which remind me of summer.
Great, thanks, Deshawn. Manisha?
Hello, everyone. Thank you so much for having me. Very honored to be a part of this great panel. I am Manisha Shabugai. I'm the CEO of Active Surgical. Active Surgical is a startup company based in the Seaport area of Boston. We're an advanced visualization company leveraging science and AI to provide surgical intelligence in the operating room. My pronouns are she, her, hers. And for those of you that are visually impaired, I'm an Indian woman. I'm wearing a red sweater. I have a medium length black hair.
Excellent. Thanks, Manisha. And last but not Neda.
Thank you, Vanessa. Wow, so great to be here with you all. I am Neda Hanafi. I am a co-founder and board director of MedTech Color. And in my day job, I lead regulatory strategy for Veranex. That's a service provider for medtech companies of all different sizes, helping you get your product from concept through to commercialization. I go by she, her, and hers. I am of African descent, and I am Black female wearing a red scarf to draw in the red colors everyone's wearing, and actually wearing flowery blue top as well, Deshawn. So I think we all there was something in the air that told us what to wear today. I'm based in San Jose, California, where it is not California weather, so maybe I should be in DC with Vanessa on the East Coast. So thank you for having me, and super excited to have this discussion today.
Excellent. So as everyone can hear and see, very powerful, very accomplished panel. I'd like to kick off the discussion with Kimberly by having you tell us a little bit about what you wanted to be when you grew up, and why did you enter MedTech? Tell us a little bit about your journey and your personal story.
Sure. A little bit of background. So I come from a long line of teachers. So, going to college was never a question. It was just more of where. And my dad used to say, study hard, because where you go is determined by your scholarship. So I think growing up and watching TV, it was the doctor, it was the lawyer. And I think one of the things that people don't fully realize, I'm an introvert, extroverted introvert, but I'm very high on the shy side. And so I was always very curious why people acted the way they did. And so I was like, I think I want to be a psychologist. And my dad was like, let's think about that again. Because you'll be in school forever, not sure how much money you'll make. And so we were at a high school college fair, and we were listening to a recruiter for a particular school, and they talked about School of Pharmacy, 100% job placement, starting salary $50,000. And immediately my dad leaned over and said, "You're good at math and science, you should be a pharmacist." Okay, let's try it. So went through pharmacy school and finished, but I knew I didn't want to be a traditional pharmacist. And there's a reason why I'm telling you the backstory here. I've had individuals who have told me things in my life, and I've kind of just stored it away. And one summer working in a pharmacy, an older pharmacist who was a woman was reading on a break a magazine that talked about an area called pharmacoeconomics. She said, "You should keep this in mind. This is going to be an up and coming area for women." And I was like, "You said economics. I'm all about the science. No, thank you." Well, I had a chance to take a course in college, hated it, but again, kept it in the back of my mind and ended up loving biostatistics. So I had a 16-year career in the pharmaceutical industry and had the fortune of being laid off because there were some redundancies in a particular area. and always in the area of health economics and outcomes research. And so I knew I wanted to do something different, and I gave myself a little bit of time. ResMed called, and I had never heard of ResMed. I didn't know anyone or knowingly knew anyone with sleep apnea, so I wasn't familiar with one of our largest products that we make, a CPAP machine. And so when they called and explained, I was like, oh, that sounds really interesting. There's data, you have this interest, you want to build out HEOR. And so I said yes to an opportunity. And I am so glad that I did. It's been such a fulfilling career that we can get more into that. But that's really why MedTech. I was opportunistic, as I have been throughout my career, and explored a new area and have really found the place that I would love to end my career in.
Oh, I love that. There's some great nuggets. I too am I would say an introverted extrovert. So that definitely resonates with me. I love how you talked about the fortune of being laid off, right? People tend to not think of those, those stumbling blocks or those things that happen in our careers that may seem at the time, troubling or problematic as actually opportunity windows. So I love that and would love to get into that a little bit more. So, and then I like the idea of keeping those little nuggets that people, kernels that people drop for you in the back of your mind. So we'll talk about that as well. But Manisha, I'd love to hear, same question. What did you want to be when you grow up, and why MedTech? How did you get here?
Great, thank you. So I guess also a little bit of background. I am a first-generation American. My parents immigrated from India. And so culturally, I was surrounded by doctors, lawyers, and engineers. So growing up, I sort of assumed, because I was good at math and science, that I would become a doctor one day. And so I always sort of in school was thinking I would one day, go into medicine. It came time to apply for college, and I was talking with close family friend, and he was a psychiatrist, gave me some advice and said, I don't think you should be a doctor. I think you should do something bigger, do something that's going to change the world. You should go into engineering. And so on his advice, I decided, okay, I think I'll do engineering. There are not a lot of women in engineering at the time. And he thought that, this would be a way for me to be able to make an impact, not only professionally, but also, as a female going into a profession that was very male dominated. Went to school, studied engineering for 4 years, actually got a graduate degree in engineering and also a half MBA, and realized that I did not want to be an engineer. So after all that schooling, I decided, well, what am I going to do now? Because I really don't want to be an engineer, but I actually discovered that I loved the business school and I loved the business program, which was something that my math and science brain really had not had a lot of exposure to. And I thought, wow, this is fascinating. I think I want to pursue this a little bit more, maybe a little bit to the dismay of my parents, because again, lawyers, doctors, engineers, they weren't really sure what I was going to do with business. But I decided to go into consulting out of graduate school just to get more exposure to the business side of the world, and did strategy management consulting for a few years. It was in the telecom space, and that was a departure for me because again, I always felt connected to healthcare, always, again, going back to my roots, thinking I would be a doctor one day. But I loved the company that I ended up working for. And so I really went with the team and the people over the space that it was in. And then after a few years of that, I realized that the quality of life of consulting was not for me in the long term. Being a road warrior was not something that I wanted to do forever. And I had an opportunity to go to a medical device company and do strategy work. So it was a perfect segue into medical device, into sort of the healthcare space that I loved. And so I made the transition early in my career into healthcare and have stayed in this space ever since.
There's so many connections and things that you find out about people just in these conversations. I'm also a first generation American, no math and science background though. But I find that connection interesting and fascinating. So Deshawn, how about you? What did you want to be when you grew up, and why MedTech?
Sure. So growing up, and I'm from Baltimore, which is dominated in a lot of ways by Johns Hopkins, but growing up, I wanted to be one of two things, a lawyer or a neurosurgeon. And so that was always kind of what I wanted to do path-wise. I was very inclined towards science. I was also very inclined towards justice, and was always finding myself in positions to advocate and defend people. So as it turns out, when I was in college, paying my way through, I had to make a financial choice. And so I landed on law school. It was shorter, it was faster, and I needed to stop paying for school. And so I went to Georgetown, found myself in DC, but always having a really solid interest in medicine. Frequently quack diagnosing my friends pretty accurately most of the time. And as things happened after my first year of law school, I did a fellowship, and then I found myself working at the U.S. Department of Health and Human Services in the Office of Inspector General, which is the division that works predominantly on healthcare fraud cases. And I was a litigator there, where I essentially kicked bad players out of Medicare for about 7 years. And it was a great way to marry my interest in science and medicine with my work, which was amazing. And so after leaving formal practice, I found myself working in the association space. And in this space, I started doing more Medicare policy work at an association for ophthalmologists originally, and then found my way over to AdvaMed, where I started doing the similar work on Medicare payment issues, working on coding issues, understanding and having a better sense of the challenges for medical device makers, but also having a better understanding of what exactly was being developed in terms of innovative technologies. And so I find the work to be absolutely fascinating. I find that it's a great way to continue to not only build upon my science interest, but also to be an advocate still, because now in this role, I advocate for our members to get their devices to market so that they can ultimately get to patients. And a lot of the work that I do focuses on making sure that patients ultimately are getting the best outcome possible, because they're having a healthcare experience that is supported by access to the technologies they need to get them the best outcomes. So that's why MedTech for me.
Excellent, thank you. Former government lawyer, so I love all these connections. I am myself. I spent my formative years at FDA. Neda, round it out for us.
Round it out. I mean, I think the theme is you are either going to be a doctor, a nurse, or an engineer, or a lawyer, right? I think it goes back to our roots, or maybe that's all we knew then. It's so interesting, the number of different careers available to the new generation nowadays. So similar story. Like I said, I grew up, I was born in Sudan, and also was raised partially in the UK, and have only been in the US. Although I say only, it's about 20 something years now, which is quite a bit, but holding on to my accent. And it stems from the aspect of, you know, we want to serve, right? I think what I heard was we're all coming to it as we want to help people, and how do we help people? It was really doctor, nurse, or lawyer, right? Or sometimes police officer, something in there, you know. But I also was at FDA, Vanessa, as you know, and say I spent my formative years there. And it really, you know, FDA is a public health agency with a mission to promote and protect public health, and predominantly engineers and clinicians in there. And we look at files in front of us and be like, you know, making decisions solely, kind of maybe missing the bigger picture of the impact of our decision making. So I was very drawn into the public health space, and chose to add on a public health degree, and at Hopkins in Baltimore, where their mission is to save lives, millions at a time, right? So the broader impact of our decision making coming into play from the regulatory aspect. So I think it was part of just, how can I help people? How can I help people in a broader, more global manner, and at the core of it being patients at the center, and wanting to make sure that people had the right to a healthy life, and again, core of public health, core of service, so that they can do their best, and that it's regardless of race, age, ethnicity, sex, that you should have access to healthcare. And I think that's part of why we're here, and technology has the capability of being able to do that, maybe in ways that we didn't have that opportunity in the past, but making sure as we're moving forward to developing these technologies, it's with the mind of reducing inequities, which I'm sure we'll get to in the end. But I think you all said it, very similar journeys. So it's so interesting to see, like you said, Vanessa, the connections.
And one of the things that I find interesting and fascinating among the group is that at various points, there was somebody, whether it was a parent or a family friend or someone who looked at you and said, based on what I see in you or what I know of you, I think you should be this, fill in the blank. And in some cases you said, yes, that makes sense. And you followed that path and then pivoted. What do you see in your respective organizations and in your journeys as one of the sort of biggest challenges in getting new energy, new people, more diverse and representative professionals into the medtech space? And I'll open that up to anyone who wants to start.
So I can jump in. I think prior to joining Active Surgical, I was with Olympus Corporation for almost 18 years. And one of the big initiatives during like the later time that I was at Olympus was around diversity, equity, and inclusion. And we did a lot of training and education, especially of our executives and management layers, on implicit bias, unconscious bias, particularly when it comes to interviewing and bringing candidates into an organization. I think it's so common and understandable that people are attracted to people who are like them. And so what often happens when you're interviewing, you unintentionally are attracted to candidates that look like you, have had similar backgrounds as you. And similarly, the candidates are more comfortable when they interview with people who are like them. So I think one of the things that's really important as we think about attracting more diverse talent into organizations is really thinking about who is involved in the interview process, who is screening and talking with candidates, making sure that you have a representative group that is a part of that process, I think is a really important way of not only making sure that you are not biased when you're exploring your candidates, but that candidates come to your organization and feel welcome and feel like they can see themselves within that organization because they see themselves represented by the group that's interviewing them. So that was something, especially at my time at Olympus and very much at our startup at Active. We have for a very small organization, we're a very diverse group. And I think it's really important that we are conscious about that as we talk about bringing in new talent into our organizations.
Yeah, I really agree 100% with what Manisha said. And one thing I would add on is that I think sometimes we get fixated on hiring for resume as opposed to for skill set. So what you've heard here is you've heard a lot of people coming from different industries and backgrounds and then still making their way to medtech and being successful in the medtech space. Because what we know that the real skill set is curiosity, the ability to synthesize thoughts, the ability to be an advocate. A lot of those skill sets are developed in other areas. And I will say, as someone who came into this industry and went through college and graduate school at a time where health economics outcomes research was really an unheard of concept in terms of a major option, that a lot of what I learned in law school, a lot of what I learned as a political science and economics major in terms of writing, in terms of synthesizing, has served me well throughout my career as a lawyer and as a policy person. Another thing I think that sometimes hampers our success in recruiting is just spreading the word about the opportunities that are available for people in MedTech. And a lot of times when I hear people speak about our industry, it's very STEM concentrated, the discussions and the conversations. But as you've heard, I don't have a STEM background. Vanessa doesn't have a STEM background. And lots of people in this industry who work outside of research and development and engineering spaces do not have STEM backgrounds, because there is an area for all types of personalities and skill sets. So there's marketing and sales, there's people who read and write and condense complicated material into digestible material. And so I think getting the word out about our industry, the array and the versatility of the positions available within the industry, and the need, as Manisha stated, for diverse perspectives, especially as we think about innovating devices and technologies for diverse people. I think that's really important in terms of our growth going forward.
It's such a good call out, Deshawn. I was going to also add, it's where we're actually seeking candidates, right? It's easy, especially if you have a position and you need it filled yesterday. I need to go where I know I'm going to have a good pool of candidates, get through those resumes quickly and fill it, versus taking really time to say, how can I cast that net wider? Let me go to atypical places, or even ask your employees for new ideas. And then as hiring managers, insisting that you have a diverse slate coming to you. When I started building my HUR group a couple of years ago, I told the recruiter, I want a diverse candidate pool to actually select resumes to actually bring in from a phone screen perspective. So I think it's also on the hiring managers as well.
And Kimberly, go ahead, Manisha.
Yeah, I just wanted to comment on what Deshawn said about the fact that, interview for competency and skills as opposed to experience, and really thinking about what actual competencies and skills people have versus actual tasks that they've done. I think there's so many things that people can do outside of med tech and med device that are applicable to opportunities within the space. And so thinking about those transferable skills is really important. And the fact that it's not all STEM jobs. 100%. That is so true. And I think probably a misperception from people who aren't familiar with our industry.
On that point of skills, I want to pivot a little bit to how would you define and figure out what your brand or what your superpower is, or what your best skill is, right? That differentiates you, especially if you're early in your career. Like, what was that process for each of you? And did you have a mentor, a sponsor, or somebody that really helped you define and figure out what's your superpower and how you want to leverage that in this industry? I know it's a complex question, but Netta, do you want to take that one?
Maybe I'll just jump in. I think it ties into the conversation. I like to ask questions of why from a young age. Stop asking why, but why? But why? And I think it's that, being curious, the curiosity aspect. And then adding on, if you like to solve problems. For me, it's like scientific, logistical, or strategic problems. But you can, in MedTech, there's all aspects, all different problems you need to solve. And you can just bring that curious mindset of how can I solve it in a more effective way, and then with diverse perspectives. And the only added bit is defining the problem is really, really critical. And that's what you learn in public health. Such a well-defined problem is a half-solved problem. So spend the time to define it. And if you're curious about that, I think there's something for everyone in MedTech, or specifically since we're talking MedTech, that could draw you in. So if you like to solve problems, MedTech's your place. But to your point is, I asked the why and that would lead you to your next space. But Kimberly, I know you're unmuted.
Yeah, I will say I've had mentors, I've had supervisors provide feedback, and I'm also intellectually curious. And so what I would do is collect all of that. And what I tell people is you still have to sort through the feedback, because not all feedback is for you to do something from an action perspective, but see where the trends are. If you're early in your career, what are you hearing repeatedly? And see if that's something you want to further explore or to develop. And you can then turn that into something amazing later that may not even exist today, right? I think this up and coming generation is taking things that I would have never thought to put together, and now they have this whole career, and I'm sitting in awe of that. Sponsorship came later, especially the importance of sponsorship. I began to understand that, especially navigating through organizations and wanting to be at positions of greater influence and broader responsibilities. And then there was another piece of your question that I have forgotten now, but I do think it's about figuring out how you can show up authentically, being really comfortable with who you are, and then find a way to leverage that from your career perspective. And I think you won't you won't be burned out so soon because you're working from a point of strength. Oh, that was the other piece. There's tons of assessments that people can take. I mean, Strength Finders is a huge one, various types of like Myers-Briggs type of things to understand, who are you and what types of jobs probably marry up with who you are intrinsically are some of the things I would recommend to the group.
And I think I would add, it seems really simple, right? But figure out what you actually like to do. And you might not like to do what you went to school and studied for. You might not figure out what you like until 20, 30 years into your career. Or as I tell people frequently, because every once in a while I run across people who love their work. And you ask them and their face lights up and they're like, I love this job. And I'm like, don't ever leave a job that you love. If you love it and you're good at it and you're impactful and you're effective, that job and what you're doing for that organization will 9 times out of 10 either make a way for you to get whatever you need, or you will take those skill sets and build upon them and create your own path and have exactly what you want in your professional life. But a lot of it is really kind of marrying your interests and always still having that interest in your work. So as I say, I really enjoy just what I learn in my work from day to day. That's not to say work is not without stress or challenges, but at the end of the day, at its core, I really just am intrigued by what I do. And I'm intrigued by understanding and appreciating the impact of the work that I do and what that means for patients and what that means for my community. And so I think that those are some of the things that I really do appreciate about my experience and that I've come to know over time. Kimberly mentioned sponsorship. I cannot say that I've actually had a sponsor yet, but because I have made it this far professionally without having a traditional mentor sponsorship pathway, the thing I have benefited from equally as much is the advice and counsel of colleagues and friends in my workplace. And I've had the blessing of making tremendous friends over the course of my career, and having them to provide advice and counsel and information and to teach me things that I needed to know for my job, but did not learn through a past job and had not had exposure to through my educational experience. So there's a lot of ways to get that information and to figure out what your path is and to move towards finding your way.
So I heard in terms of superpowers and skill sets that are transferable and set you apart. I've heard curiosity, always wanting to know the why. I've heard a love of learning and a desire to engage. Manisha, what's your superpower? What sets you apart? What's the skill set that you've cultivated?
Yeah, I think probably 2 things that I was able to sort of build and cultivate through my educational background and some of my early professional experiences. One is critical thinking skills. So I talked about the fact that I went through engineering school and decided I did not want to be an engineer, but I would not have changed that educational experience for anything. It was really foundational in helping me think through problems, be able to think critically about something, break it into smaller pieces and work through and problem solve. So I think critical thinking skills is one of the superpowers that I tend to lean on. And then I think just communication skills. Very early in my career, I got a lot of great feedback about just being able to communicate effectively, whether written, orally, presentations. And I think that for me, that's something I've hung on to, and it's been something that's helped carry me through my career.
So we are all women of color on this panel who've come up in the industry at a point where maybe there wasn't as much intentionality and organizational focus on diversity, equity, and inclusion, both in hiring and promotion, and how we kind of view the benefits of having a diverse workplace. I'd like to hear from each of you, just any sort of challenges, lessons, wins, takeaways that you've had as women of color in MedTech, and how that has influenced how you show up with your superpower, and how you want to lead and make an impact. So I'll start with Kimberly on that one.
Okay. There's a couple of things. I mean, I've always been the only. So I've gotten really comfortable in that from pharmacy school. So I have a doctor of pharmacy degree, went on to do a master's fellowship at a large university again. Well, and our group was actually pretty diverse, but there was 4 of us. And so I think it's coming into the room, not necessarily being shy about being the only, but also knowing that I bring a diverse perspective. And because I've had other experiences, so Deshawn keeps talking about the other experiences you have from other industries, you come in with something very unique, a very unique perspective. Leaning in on that and being willing to share my perspective has gained me a lot of credibility within the organization. And I think also coming into industry, cross-industry types of engagements, like I work with Deshawn really closely in one of the AvaMed work groups, other people start to notice and they're watching. And someone recently said, I love how you just come into a room and the way that you interact. And I was like, oh, didn't even think about that. Of course, they're talking about Zoom, but I mean, it's one of those where, again, I'm really working hard to be authentic in who I am and being comfortable. And so for me, that is one of the keys of how you excel within MedTech, because I think MedTech is unique in that things are fast-paced. There's a lot of innovation going on. There's a lot of activity and creativity. And so you can find your niche, but show up authentically and be sure to speak your perspective, because it is so valued.
Neda?
Yeah, I love that, Kimberly. I think it really is about just being who you are and being able to step into it. So one of the best advice I got was from John Kabul, who was the Assistant Director for Health Equity while I was at FDA. And she said, no is the opening bid, Neda. So not taking no for an answer, and how can I switch that no into a yes or even a maybe, and you know, what if, the curiosity of why. So even if you said no, why? So let's talk about this. Let's unpack that and figure out how to get it to a yes. So I think being able to lean into that, and as you said, Kimberly, you know, sometimes you are that N of one. But maybe what's driven me is I've always been able to just, I'll say it, and I'll say what I'm thinking. And then funny enough, people behind you be like, oh, we were thinking the same thing, but we were scared to say it, right? I'm so glad, you know, you said it. Something someone else said to me, you know, if you keep putting your head up, you're going to get shot. Which is kind of, maybe I just was like, it's worth it. You know, I'm going to say it because I can't hold back if something's wrong or inequitable or doesn't sit right with me. I think you need to say if someone voices it, and sometimes, and that's where you find like people will, they just need one person to open that door and they're willing to all say, oh, I actually think the same thing and this, and then you can start to move towards that brainstorming to solution solving and resolving. So I think it's maybe finding it in yourself. And as women, we tend to, a lot of people talk about imposter syndrome or, not being invited to the table, or like push beyond your comfort zone would be my take. And if you keep doing the same thing, the same way, you're always going to get the same outcome. And that's not what we want if we want change. So be willing to challenge your own self. I know we have a lot of challenges we deal with daily, but I think maybe in MedTech, it's an opportunity to challenge your own self and your own preconceived notions or internal biases of yourselves. And can I really do this? Yeah, you can, because we've seen women do it and they do it. So yeah, I think that was my perspective. Just lean into maybe being a bit uncomfortable, but you'll come out better at the end.
Manisha or Deshawn, any challenges, wins, or important lessons that you've had to navigate through as women or as women of color in our industry, and how did you come out on the other side of that?
Yeah, I can share a little bit about my own personal experience, professional journey. I do want to say, similar to Kimberly, I am used to being sort of the only growing up. I grew up in middle class town in Connecticut. Not a lot of Indian people, not very many people of color at all. And so I sort of just grew up in that environment and didn't really know anything different. So I think coming into MedTech, med device, being surrounded by sort of male dominant, lack of diversity, didn't really feel all that different for me. And unlike some of the other panelists, I am not an introvert at all. So I had, I guess at times that works to my advantage. And so I found very early in my career that I had lots of opportunities that would come. And I think, being able to demonstrate my skills, more opportunities came. Then later in my career, however, I got to a point where I'd sort of reached the pinnacle of marketing within the medical device organization. I was leading a marketing organization and I was ready for the next step, which really was leading a business unit, owning a P&L. And within my organization, no women had ever done that before in the organization. So all the business units were run by men. And definitely, I don't believe there was any minorities that had run a business unit. And so I actually went for a role and didn't get it. And so I was quite disappointed, but took the time to reflect on why I didn't get the opportunity. What could I do differently? What skills did I need to develop? And I was very, very deliberate in the following years to ask for experiences, to put myself in positions where I was doing work that was really outside of my day job, to demonstrate that I had the skills and the ability to do things that maybe, my male counterparts didn't expect that I could do or had never seen a woman do before. And then when the next opportunity came to kind of break through that glass ceiling, I had lots of experiences I could point to kind of prove that I had those skills. And then I was fortunate enough to get that opportunity. So I think, sometimes we do face implicit bias and unconscious bias. People are not sure you're able to do it because they haven't seen someone do it before. And so my advice would be to put yourself in a situation where you can demonstrate the skills that you have, ask for opportunity, and don't be shy about asking to do something maybe outside of your lane, because you can and you want that experience. And then you can kind of build on that to get, that opportunity to springboard your career into something else. So.
Yeah, and I would just add, I think in terms of my experiences in this industry, I've seen a lot of growth and personal benefit just come through my consistently being an advocate just as a person, and my taking that sense of being an advocate and also coupling it with a sense of empathy and compassion to get the work done and to understand the perspectives of the membership, to understand the perspectives of even the agencies that we interact with. And what that has facilitated are good dialogue, good relationships, and the ability to understand the perspectives of a wide array of members who sometimes are not on the same side of the issue, to understand the perspectives and sides of the policymakers, to try to get to a mid position where we might be able to get something that at least is improving the position for both sides, even though both are not coming out 100% with what they want, and a better understanding of what's needed to ultimately get to good policy making in this space. So as I think through that in the context of health equity, we know that there are longstanding issues with regards to accessing technology equally by different populations. And we understand centuries-old problem, right, will not be fixed over time or overnight. It's going to take a significant period of time and invested interest and dedicated focus to get this issue resolved. But we also understand that a lot of resolving that issue starts with recognition from both sides. So people kind of understanding that people knew and the people didn't know, appreciating that lack of understanding, following on with education and improvement of that understanding, and then working collectively at a pace that isn't slow enough as to never get the issue resolved, but doesn't rush people to get to an answer that they are not ready to embrace, but really kind of finding that midpoint. And so a lot of my legal background and what I do now is all the same, kind of advocating, consensus building, mediating to get to a point that works for everyone.
I love that, Deshawn. Sorry, Vanessa, because you're saying kind of trying to put yourself in someone else's shoes and speak. You know, sometimes it's advocate for what you don't believe in can help you understand, or what you're against. Like if it's a impasse, put yourself in the other person's shoes and speak to it. I love that. And I was actually going to turn it around, Vanessa, and ask you. You have tons of wisdom and experience in this space. I would actually love to hear what your superpower is as well.
I think that my superpower is strategy. It is the ability to take a lot of disparate ideas and goals and actually translate it into a cohesive path forward where everybody understands kind of where they're going, what their role is, how you define success. And for me, the thing that breaks my heart and how I want to serve the world and serve the industry is it's always been injustice of every kind, but particularly the impact of racial and ethnic bias, disparities on access and the ability for people who are talented to kind of reach their potential. So that's the stuff that lights my brain up. And I see technology and innovation as a way to bridge, you know, disparity, right? It's a way to bring technology into the hands of people who might not have access to care. It's a way to tap into people's superpowers and skill sets so that they can leverage them in different ways. And so that's the thing that kind of lights my brain up. Leave it to Netta to like turn it on me. In the time that we have left, ladies, I would love for each of you to kind of speak to, if you had one takeaway, one piece of advice for the folks on this call, regardless of where they are in their careers, what would it be in, 2 sentences or less?
I'll start. I think what I would say is never be afraid to ask the follow-up question. That follow-up question will get you the answer to so many things: work questions, life questions. Even ask yourself a follow-up question when you have a question about an issue. Ask that follow-up, and And remember, I mean, people teach us this like in kindergarten, right? There's no such thing as a stupid question. The only thing that is lacking is when we are afraid to ask the question and get the answers that we need so that we can make the most informed decision possible.
Great. Kimberly, you want to take that one?
Sure. And I wrote down tons of pieces of advice, but the one that I always give people that I hope is empowering is that you always have a choice. And sometimes we forget that, whether we're in the midst of a heated discussion, you have a choice of how you engage in that or not. And that could be a positive thing. But even more importantly, as you're making career decisions, and if you're trying really hard to get someone to appreciate your skills, and if they don't, you have a choice. And as we've talked about, there's so many opportunities within MedTech. I invite you to rediscover what is possible.
Love that. Manisha?
All right, I think two things. One, we've already kind of touched on quite a bit, which is really just leaning into your superpower. I think that is one of the best advice I got when I was early in my career. It is the thing that is going to differentiate you from anyone else. And so really lean into that, and it will continue to help you differentiate and thrive in your career. The other, I guess, advice I would have is for the women in the audience. I came across a statistic that women will only apply for a job when they meet 100% of the qualifications, and men will apply when they meet 60%. And so I want to encourage all the women out there to put yourself out there. I think imposter syndrome is a real thing. I'm not going to lie. I've suffered from it myself. And so you can do it, and you should put yourself out there. You can grow into a role if you have those skills and capabilities, and you're curious and hungry to learn. You can grow into a role. So don't be shy on taking a chance.
Love that. Netta, last but not least, what's the one piece of advice that you'd like to leave folks with?
Oh, these are amazing. I think Ruth Bader Ginsburg said it best. Women belong in all rooms where decisions are being made. And we do, regardless of age, color of your skin, your educational level, how much money you have in the bank, whatever it is. I think if you look around, women are the ones who are getting things done. Yeah, I sound sexist, but they are. You have a problem, give it to a very busy woman and she will solve it. And our pitch competition showed that recently, the MedTech Color pitch competition. You should take out the 3 top winners, all female, all mothers with young children, all with personal lived experiences coming to solve a problem, right? And I think we all spoke to it, that lived experience is invaluable. And that different perspective in solving problems. That's why we're here. We want to make things better and solve problems. So I think it's just own your power. Just being a female is one power in my mind, and lean into that, and don't let anyone kind of, dampen your light. You have a light and you have a value to add in anywhere you are. So own it and bring it. Vanessa, yours.
I always say, just always make sure your passport is updated. Always have a passport and make sure it's up to date. And that's really all about, raising your hand, seizing the opportunity when it comes, and being ready to make that move always. So I would like to thank all of you. You are all amazing, and I'm consistently humbled by the sheer talent and the diverse experiences and the wisdom that comes from just engaging in these conversations. I'd really like to thank you all for sharing, for engaging, and for bringing such, value and authenticity to the medtech industry and what we do. And thank you to everyone who joined today. And I will turn it over to Anna to give us our closing remarks.
Awesome. Thank you so much. Wow. That was such a wonderful discussion. Seriously, a big thank you to all of our panelists for being here today. So with that, we have reached our time. We just sent a survey in the chat. If you could take a moment to fill that out, we would really appreciate it. It gives us great feedback when we look into future programming. And I'd like to thank MedTech Color again for your partnership and helping us put on such a wonderful event today. So with that, thanks for being here, and be sure to check out whymedtech.com to learn more about our campaign. Have a wonderful day. Thanks, everyone.